He ugly me.
Yes, today Renee has been very gracious to allow us to demonstrate some techniques which are procedures which we do in our office. One thing we're going to do is some Botox. We're starting doing Botox treatment today, and one thing which we like to do Botox a lot of times we're going to put a little bit in this we call this glabella area. That's where we have the 11s. People always talk about those frown lines that are always difficult to get rid of. And what Botox does, it will help to soften that up. I like to say it doesn't always make it disappear, but it makes it look better. It makes it look softer, which is kind of really what you want to go for. You know, I always tell people that you want your outward appearance to mirror how you feel inwardly, not to erase every wrinkle, but just to make you look more youthful. You know, if a lot of times you look. You know, if you're exercising, eating, doing a lot of things to keep yourself healthy, you want your outward appearance to mirror that. So one thing we're going to put a little bit there. We're going to do a little bit to soften the forehead. You know, once again, same thing with the forehead. These lines, you can soften them. We'll make them disappear. And one issue is sometimes people try to make that completely disappear, but sometimes when you try and make that too soft, you bring the eyebrows down, which make you look angry or sleepy. We want to avoid that. And lastly, we're going to put a little bit around the outer part of the eye, the lateral canthus, helps the crow's feet around there. We're going to do that, and that's what we do as far as the Botox treatments, which we're going to do. We're also going to do a little filler. We're going to demonstrate filler in the nasolabial folds here. Same thing, helps to soften those folds. We're going to bring it a little bit onto the marionette lines, which we call it in here, helps at some call it the jowls, helps to soften that. And lastly, we're going to put a little bit around the lip, just the lip lines. Helps to soften those lines in the upper lip. Same thing about it is to make an improvement there. Also, we put just a little bit in the margin. And some people are always a little concerned about that because a lot of times they're afraid it's going to make the lips more swollen. But what we're just trying to define the lip. Because one thing that happens, especially as we all get older, is we lose this line. The lip kind of curls down in the mouth. So then, for example, what we do by putting a little bit of margin, we can raise that up. Start out, we're going to put a little bit in the glabella area right here, and then we're going to put a little bit in the forehead. Okay. And one thing that's important to note is that the needle which we use for this is very fine, about the size of a hair, very fine. So some people are concerned about whether it's hurt, how much discomfort. It's usually fairly minimal. Okay, a little pressure now. We're going to pull up in the forehead. And like to see how the muscles move, because you want to tailor the treatment depending on how the muscles tend to move. So right now, have you raise your eyebrows for me? Okay, good. Relax it. Okay. And I try to apply the Botox in the areas in between the lines. That's where the muscle is. Raise your eyebrows again. Okay, good. Relax it. And right after the treatment, I like to use a little cytoactive. What's cytoactive? It's a little hyaluronic gel, and what it does, it just prevents the skin from bruising after the treatment. Okay, now we're going to put a little in the lateral canthus for the crow's feet. Squint real hard for me. Good, relax it. And the nice thing about this treatment, same as putting it in this area, it helps to give a nice brow lift. It usually takes about 4 to 7 days for Botox to take full effect. So one thing to realize that once you do it, you don't see the changes right away, but it takes about a week. Usually when you first do it, it may take a little longer. It may take a couple weeks, but it will eventually get there once you lift that and soften those areas. Okay, I'm going to come on this side here. Same thing, squint real hard. Good, relax it. Just going to massage that for a second. The other important aspect about Botox, which helps with the treatment, is we try to encourage you to use that muscle afterwards. So usually for, the next hour, to try to have you use that muscle, either like in this case, squinting, raising eyebrows, frowning. It appears to help your body take the Botox better if you use those muscles over the next hour. So it helps somebody you're mad or angry at. You can make faces at them. Hello. And now we're going to put a little cytoactive over there, once again, to help prevent any bruising. And it looks good. Usually this kind of treatment does not bruise much, but once in a blue moon somebody does bruise, and this prevents it from happening. Even in a rare case somebody does bruise, that usually resolves in 2 or 3 days. It's not long lasting. Okay, good. Now we're going to do the lip lines. We're going to do lip lines, and then I'm going to actually do the nasolabial folds. So already what I've done, we've had some numbing cream, so I'm taking some numbing cream off the areas which we've done. And I've also taken the liberty of putting a dental block. You go to the dentist. It just makes it a little bit easier, I think, when you do the lip lines. The topical medicine is usually good at here, but usually here I like to put that in to give a little better anesthesia. Makes the treatment a lot more comfortable. And what we do is we just thread a little bit in, and then put a material as we bring it out. This is a really good treatment for these little fine lines here. Okay, here we go again, a little stick. And with this top, you see these lines just puff it as we go. Great, excellent. Good, how you making out?
I'm good.
Okay.
My nose is numb.
Right in the center here. It's doing great. It's doing really well. Especially with the anesthesia, it makes it actually pretty comfortable to tolerate. As you see, she's doing very well. Keep a little pressure here. Now we're going to go to the other side. Very good. We're going to put a little bit in the margin. Just help what the margin does is The lip, especially the older lips go down to curl into a mouth, so we put a little bit just in the margin. It helps to pull that corner back out. And see, it just makes that margin just a little further defined is what it does. Okay, good. You can see between this side versus that side how much better defined that margin is. Come back to the other side. Usually after the procedure there will be some puffiness there, but what I have you do is just ice it for the day, keep the head elevated, and that reduces any swelling. Swelling kind of goes up and down. Most of the swelling resolves in about 24 hours, but it can take up to 72 hours for that to completely resolve. Okay. Very good. When you take a look, you can see how the lip lines are much softer in here. This border is more firm. One thing about that border is firm, it keeps the lip from crunching, so it helps that material to stay in there longer. What we're using today is Juvederm Ultra Plus, and that usually will last about a year's period of time. Okay, next we're going to do the nasolabial folds. She's doing great. We're just lifting. We see where there's a little depression. We just put more in to lift that up. Yeah, just trying to put it in real slowly. Just real slowly. Okay, same thing. We're just trying to lift this line up here. And she's doing great. We're just slowly lifting it up more and more. You turn towards me. Okay. Put your head up a little like this. And even right now, we're not done, but even if you see the difference, you see how much smoother it is here versus the side over here. Maybe a little bit more tender in here. It might not be quite as numb down here. Right now we're going to the other side. It's just done great. I'm going to put the material on the Hyaluronic Acid on bruise, and we're going to massage that. And you get a little puff. You know, we give it ice packs afterwards. It'll be a little puffy. Usually, you know, a couple days, it'll be a little puffy, and that goes down. And I was like, say, really about a week to 2 weeks is when it really gets perfect, because then it really just settles in. The material, which is initially firm when it goes in, is softened up. It just blends in with your body's tissues, and really is a very nice appearance. And the thing, once again, is trying to give a very natural look, not trying to erase every wrinkle, every line, but to make it look very natural, so you look rested or relaxed. We try to just really put enough material underneath that to really lift that.
Most people don't realize how much of an art it
Yeah.
really is. They just say, oh,
Yeah.
just get a shot of BOTOX. Yeah. It's not as easy as.
And the thing is, you really have to, you really need like a lot of, but you need some of everything. Like a lot of people think one thing is going to do it all, and you need, you know, some things to get better with laser, some things get better with BOTOX, some things get better with filler.
But do most doctors take the time, like the time that you take to tell them all that? Or
Well,
because if they're good, they should, right?
Well, if they're good, they should. I mean, I think some. I mean, it's like anything. I think there's some people who do, and some people don't, and some. It's like a lot of times we
collect the money, get them out.
It's like when you do it takes time to do it. You know what I mean? And like sometimes we talk about even. I mean, Renee's got a really strong pain tolerance, but if somebody who doesn't have a strong pain tolerance is, you know, the slower you go, the more comfortable it is.
Mm-hmm.
But you know, the thing about it is you have to be willing to take that time, you know.
Right.
After the material goes in, we like to just massage here. What it does, it just smooths it out. You know, anytime you do a procedure like this, you put filler in, you're going to feel a little lumpy, bumpy, and what this does, it just makes it a lot smoother. The people always do this by hand too, but I think it just is a lot easier. The results are much more consistent, I think, when you use a device. And I'm doing this for like 20 years, and this really helps the most. I think it's one of the best inventions to come along.